I'm told pain is just a part of getting older, isn't that right?
Not always, and it could be. The fix isn't some invasive surgery. For one of our next guests, 25 years of pain stopped with a gentle kind of a gentle kind of care called NUCA.
You got it. You're all over it. Here this morning, Dorothy Price, and next to her, Dr. Drew Drummond from the Spinal Balance Health Center. Thanks for coming this morning.
I can't say that.
That's okay. Dorothy, tell us exactly what was bothering you.
Pretty much everything. I had pain in my shoulder left over from a car accident. I had pain in my left hip that I found out later was from walking crooked all these years. Was suffering severe heartburn. Of course, I'm thinking that's job stress. Vertigo. I'm just getting old, right? You know, once you get over about 45, it's all downhill from there, and things get stiff and you can't move.
Yeah, so you thought you were just falling apart.
Pretty much.
You didn't think about a tiny bone in your neck causing a lot of that.
I didn't even know that bone was there.
Yeah. So I'm wondering, because of all of these I guess the different kinds of pain you were experiencing, had you tried different kinds of treatment to deal with it?
I'd been a patient of chiropractic ever since my bad accident in 1997. And they made me better. It helped, but I still was I never had the mobility that I once had. And I've just figured, well, you know, I've had a lot of fun with my body in the last umpteen years, and this is what I've got left.
Little did you know you had more fun to have with your body, so you just learned to live with this pain. Then you went to the Spinal Balance Health Center, and you talked to Dr. Drew Drummond. What happened from that point on?
Well, I actually saw the show.
Our show?
Yes.
Oh, great.
And that's where I saw him. And I was looking, I'd moved closer to Omaha. I was looking for a closer chiropractor, and I thought, I like this guy, you know.
Yeah.
He's
a pretty likable fella.
He's all right.
Yeah. So I thought, well, I'm going to, you know, give him a call, give it a try, and the discount didn't hurt either.
Yeah. So what was your experience? You go in for your first visit, then what?
I assumed he was like a regular chiropractor, you know, and that I was going to get a regular full spine adjustment. And
he puts you on the table and starts pressing on different parts of your back.
Yeah, you know, just moving things around. No, he actually educated me about NUCA first. Watched a video, and I went, yeah, right. Immediately I'm going, this was a mistake, but it's only going to cost me $50. What the heck? So
I love her honesty, Drew.
Yeah, she is honest.
You know, and so I figured, well, I'm already here, you know, I'm going to give it a try. He did the most thorough x-rays I've probably ever had in my life anywhere. And when I looked at my neck, I was like, wow.
So even you could see in the x-rays that something just didn't look right.
Oh, yeah.
Are you feeling better now?
I feel 10 years younger.
Yeah.
I feel a lot better than I look.
You look great.
Good for you.
Doctor, you've heard this story.
It's been amazing.
That's great.
You've heard this story over and over. I've heard this story over and over.
Yeah.
What was it in her case that you saw right away?
Well, her posture was off. Her body was imbalanced. And like most people that have joint pain, it's not the joint that's the problem. All of our joints, they start out healthy joints, and then when the body is imbalanced, gravity has more of an effect on us over the years, and they just start wearing out. And most of the therapies deal with the joint and which one hurts and what can we do to this particular joint. And sometimes we just got to take a step back and look at the person as a whole and figure out why that joint is hurting them. And usually it's a posture imbalance. And what we do is we correct a misalignment at the top of the neck that will affect the nerves that control the body's posture. And what we do then is straighten the whole body up as a unit and relieve the stress out of all of the joints, including the ones that hurt.
This is video of an adjustment, not Dorothy, but another patient of Dr. Drummond's. And I think this is why you said, yeah, right, how's this going to work? Because it is so gentle, but I think this is a good illustration.
Yeah.
It works with chronic pain.
Yeah, it absolutely does. You would think that a light adjustment like that would not have the effect it does, but when you start improving the function of your central nervous system, you can really improve every function of your entire body, posture being one of them, which leads into chronic joint pain. But there are a lot of other functions too, where she had, you know, chronic acid reflux, she had vertigo, and all these things are affected by nerves. So if you can affect the nerves in a positive way and get the body functioning better, it's really just limitless what the body's capable of.
And I'm sure the patients come see you for one symptom, you treat them, and then they notice other areas of their body that feel better.
Yeah, they do. There truly is just a full body healing effect that takes place when you start affecting the central nervous system. And joints are just, everybody has joint pain because some of the nerves that are most easily affected by this misalignment affect posture. posture. So most people really do come in for a neck pain, a back pain, a hip pain, something like that, and they're really just amazed when they start, the digestive system works better. We've had, in fact, people who've had reproductive and female issues that get better. It's limitless, really.
All right, how do you know if somebody watching now hears her story and says, I totally get it, got chronic pain, how do you know if NUCA is right for you?
The only way to do it would be to come in and have me take a look at her, at the person. And there are real great indicators with a person's posture that would tell me if there's a misalignment. But ultimately, the diagnosis is like she was saying, take a very, very thorough, very specific set of x-rays which tells me how to figure the math out to how to correct the misalignment, and that's how it works.
Well, she mentioned that $50 offer and said, heck, why not? Dr. Drummond is extending the same to you today. So the first 30 people who call his office, you'll receive a consultation, an exam, and that whole set of thorough x-rays for only $50. It's not a joke. Or you don't show up and he says, okay, well, it's actually really that's the deal. So we'll show you the phone number and some information about getting in touch with his office so that you can be one of those first 30 people to dial in.
And Doc, how fast do those 30 go? Do people need to get on the phones right away?
Yeah.
It just a lot of times depends on the guests that we bring in, but with the way Dorothy did, they'll probably go pretty quick.
All right, the number 452-3400. If you'd like, you can learn more about NUCA Care and what they're doing at Spinal Balance Health Center online at spinalbalancehc.com. Doc, it's good to see you as always. And Dorothy, a real pleasure to meet you.
Glad you're feeling better, too.
Okay, and thanks for watching. Thanks for watching The Morning Blood. We appreciate that, too.
Yeah, that's right. Thanks a lot. Earlier in the show, you saw Mary right here. Her husband, Troy, and their dog Action inside the newest issue of Metro Magazine.
Yeah, when we come back, the cover girl.